To start off with, I just wanted to read your tweet from June 1st, and you said, "Today I stood with the governor and lieutenant governor of the great state of Michigan and called racism what it is, a public health crisis. Let's work to build and change the system that continues to oppress Black and brown people in America. Hashtag justice for George Floyd." And I guess to start off, can you just share what you were feeling when you both said that and then wrote that tweet?
Sure. I mean, I think there's really no question that racism has been a part of American society really since its inception. If you know American history, you know that racism has been a part of it, whether it's slavery, Jim Crow laws, and how just in general, people of color have been treated historically in this country. And so I think what we're all seeing is really just a reflection of that, and particularly the murder of George Floyd is also a symptom of that. So when I talk about a public health crisis, what I really mean is that it's something that's a large burden on society. It's something where disproportionately a certain segment of our society is impacted. And importantly, and this is really critical in public health, importantly, there's something that can be done to actually prevent it. And then particularly for it to be a crisis, it means that those things that could prevent it aren't actually being done yet. And so that is why I'd say racism is a public health crisis. We all know that everyone, because you are a human being, you have biases. I've seen it in my own people who I practiced with. Again, I'm not saying that it's always intentional, sometimes it is, but when you change your treatment or testing and management plan for people of color based on what assumptions you have about them, whether it's how they may perceive pain, whether or not they're going to comply with their treatment, that has implications long term. So it absolutely does connect when it comes to racism, policies, and how it impacts communities of color.
So you hit on it a little bit, but I wondered if you could kind of tell me some of the other major racial disparity health outcomes that you see in the health industry that people might not know about. I mean, we've seen the coronavirus data, but what else don't people maybe know about?
Absolutely. So we know that an African American baby in the state of Michigan is almost three times as likely to die before its first birthday as a white baby in the state. We also know that an African American man has a life expectancy of 69, whereas a white man has a life expectancy of 76 in the state. And literally, if you look at zip codes in the state, you can see where literally you can go from one zip code geographically to the other and see the life expectancy decline significantly just in jumping across zip codes. So whether it's life expectancy, and I could go on, whether it's incidence of heart disease, cancer, there are these disparities that, again, they don't exist because of the difference between skin color, right? Race is something that really human beings have decided is something that's important based on how people look, but really on a real genetic basis, there's really not much difference between human beings. It's how we treat each other that really makes the difference as far as these health outcomes.